Hello, welcome to the channel. You're very much welcome to this channel. Happy New Year, wherever you're joining me from. This is Dr. Irabo, and in this channel, we'll talk about health for mothers and health for children. And today, we're going to be talking about prolapse in moms, prolapse in women, pregnancy, delivery, after childbirth. You're having prolapse. And what is prolapse? In general, prolapse simply means that where organs are located normally, where God designed these organs to be, suddenly these organs are shifting from where they ought to be and they are leaving this original position where they used to be. So for instance, the woman just puts to bed and she's suddenly feeling like something wants to fall off from her vagina, or she's feeling like anytime she's sitting down, she's sitting on a ball. These are some of the signs she may feel. She's just feeling this pressure down there. She's very uncomfortable. She doesn't know what's going on down there and she's very uncomfortable. These are some of the signs she may see. There are some factors that may make you have prolapse or put you at risk of having prolapse. And one of such common factor is pregnancy. By default, the moment you become pregnant, pregnancy can put you at risk. And when we say pregnancy, the weight of the baby, the effect of the hormones on the woman's body, all of these things can make a woman experience prolapse. And before you know it, after delivery, she may feel this pressure down there. She may feel like a ball. She may feel like she's sitting on a ball, or sometimes she may just feel that something wants to fall off from her body through the vagina. And these are signs that the organs down there, it could be the bladder, it could be the womb, that's the uterus. There are so many other factors that can make a woman experience prolapse, but I want us to streamline this video to pregnancy, to delivery and childbirth, so it is clearer and it is simple enough for everyone to assimilate. So when it comes to prolapse, there are some things you can do in pregnancy. There are certain things you can do during childbirth. There are certain things you can do after childbirth that can reduce your risk when it comes to having prolapse. So I already mentioned pregnancy, but I'm going to mention the other factors that you can look into and make some adjustments so you can reduce your risk of having a prolapse after childbirth. In general, pregnancy, the weight of the baby, the hormonal effect of pregnancy, all of these things can make your body change. They can make your muscles weak. And when we're talking about muscles, or when it comes to these organs I've been talking about, these organs are supported by muscles down there. When we talk about muscles, it's not just when you go to the gym, you see muscles. There are muscles down there. When I mean down there, I'm talking about your pelvis. And these muscles, they help support these structures like the womb, structures like the bladder. They generally support the structure. So when these muscles become weak, before you know it, these organs that used to be supported, that before you know it, they will start shifting from where they ought to be. Generally, the weight of the baby is going to put you at risk of prolapse. But if you're not having a big baby, that's another extra risk of that woman having a prolapse. Another thing that can put a woman at risk of having a prolapse is putting on too much weight during pregnancy. Of course, it's good to give into your cravings, it's good to eat in pregnancy, it's good to to indulge, but as much as possible you want to be as healthy as possible. As a pregnant woman, you want to ensure your meals, your feeding in general, does not put too much weight on your body, so it does not leave you with excess weight during pregnancy and after delivery. So as much as you want to eat, as much as you want to eat that ice cream, as much as you want to indulge, ensure you're keeping it healthy as much as possible. Of course, you put on weight in pregnancy, but when the weight becomes too much in pregnancy, this can put you at risk of prolapse. So when it comes to excess weight gain, watch your feeding, watch what you eat, watch what you're indulging in, so your weight in pregnancy is not too much at the end of the day. So we're talking about pregnancy in general, effect of hormones of pregnancy on the woman's body. We talked about the weight of the baby, maybe if you're carrying a big baby, and now we've already talked about putting on excessive weight gain. Another factor is that if your stool is always strong, for instance, you're always constipated, what this does is that each time you go to the toilet, you use so much pressure to stool, and the more you do that, the more you are increasing your intra-abdominal pressure, and the more you are going to be weakening the muscles down there. So when it comes to pregnancy, constipation is something you should actually run away from. It can put you at risk of a lot of things, and one of such things is actually this prolapse we're talking about. So to your fruit, even if you're not a fruit lover, look for the ones you like. They may not be so much. Look look for the fruits that you like. So take your fruits, take your vegetables, take enough water so your stool is not constipated. But if you are struggling with constipation and it is not going away, you're doing all you can, it is not going away, ensure you're seeing your doctor. Another thing that can put you at risk of prolapse in pregnancy is having long-standing cough. You've been coughing if possible before you even got pregnant. You've been coughing for a couple of weeks, for a couple of months, and it is not going away. This cough keeps coming. Just like constipation, each time you cough, this increases your intra-abdominal pressure. And the more this intra-abdominal pressure is increasing, the more you're going to be weakening the muscles down there. And these are the muscles we talked about that help support the structures like the womb, like the bladder, and all of those vital structures. So you want to ensure that this long-standing cough is treated. So if you're going for antenatal and you have this cough that is not really not going away and you feel it's just a part of you, ensure your doctor is aware. Let them know so that it's not be that you're just battling with something nobody's even aware of. Let them know, because when it comes to pregnancy and chronic cough, really it's going to put you at risk. Another thing that can put you at risk of having a prolapse is lifting heavy objects. Sometimes you feel, maybe there are days you may feel, oh, you're so strong and you want to just lift up things that are quite heavy. Even some people tell you, oh, I want to even go to the gym and lift up some weight in pregnancy. My dear, you need to be careful. You need to ensure that you have a go ahead from your caregiver before you even go for weight lifting. Do not just say, oh, you saw some pregnant women on social media doing something like that and you're just lifting objects, or you're just lifting weight in the gym. You don't want to risk your pregnancy or risk your own health, whether in pregnancy or after delivery. And in general, even lifting things in the house, it could be water, it could be maybe a toddler. As much as possible, lifting anything at home should be limited in pregnancy. Sometimes it's not about how strong you are, it's about your safety in pregnancy and after delivery. These are some of the factors you can look into when it comes to preventing prolapse, and these are the things you can look into while you're pregnant. So these points I mentioned are basically things you can look into while you're pregnant. So let's talk about things you can do when you're in the delivery room, especially if you're going for a vaginal birth. When you're in the delivery room, that is not the time to say, oh, the pain is too much, and you're not listening to anybody. In fact, as much as it's going to be painful, you need to open your ears, because one major mistake moms make is that they go to the delivery room and it's almost as if as the pain is coming, it's almost as if you can't tell them anything. They just want to push out the baby even without listening to what the midwife or the doctor is telling them. So as much as you can, listen to what they are telling you and push when you're being told to push. Because oftentimes when you push when you're not being told to push, you can put yourself at risk of having a prolapse. When you push when you ought not to push, aside the fact that you can have some kind of terrible tears after delivery, you may also put yourself at risk of having a prolapse after childbirth. It's important you push when you're told to push, rather than just everybody understands how this pain is doing me, I just want to push out my baby. Everybody knows it is painful. This is for your safety while in the delivery room and even after you put to bed, so you do not end up having a prolapse. Even and after the prolapse, the fact that you can even have a terrible tear, these are things you want to reduce as much as possible. So when it comes to prolapse, it is something that you need to look at your lifestyle. You need to look at your daily activities. You need to look at your stool, your food. Are you constipated? Are you lifting up objects? Are you even stooling properly? Are you always having this hard stool or having a hard time passing stool? Do you have a long-standing cough? All of these things need to be looked into. Are you putting on too much weight in pregnancy? These are things that need to be looked into. Another thing you can do is ensure you're doing Kegels exercise. I talked about Kegels exercise some time ago on this platform. Kegels exercise is a very simple exercise, and what this exercise does is, but this particular exercise strengthens the muscles down there. And it's a simple exercise, as simple as I'm seated here, I can be doing my Kegels exercise and nobody will know I'm doing. So it's an exercise you can do on the go. It's an exercise you can do as multiple times, as many times as you want in a day. If you don't know how to do Kegels exercise, it's simple. Simply squeeze your bum like you want to pass stool, or while you are passing urine, you can use that to practice. As the urine is coming out, you can hold the urine. When you do that, you're squeezing those muscles down there and you can release the urine. Just use this to practice. It doesn't mean you go on and be holding your urine. No, don't do that. You can use that to practice. As you're urinating, as the urine is coming out, stop the urine and release the urine in between. So that is practically what Kegels exercise is. So when you practice with this, you can go on and do your Kegels exercise. This exercise is going to help you strengthen the muscles down there, and it's going to help you prevent prolapse in the long run. So these are the things you can put in place. These are the things you can look into if you're pregnant, so you don't put yourself at risk of prolapse. So in case you're having these symptoms already, please, it's important to see your doctor and let them look into it and manage you properly. So I hope this video was helpful to somebody, and I hope to see you in the next video. Until then, bye.